Hello, my name is Ciara O'Sullivan, and I am an assistant professor of medical oncology at Mayo Clinic in Rochester, Minnesota. I am a chair of the PROMISE study, a prospective study to evaluate the role of tumor sequencing in women receiving palbociclib for advanced hormone receptor-positive breast cancer. The goal of the PROMISE study is to learn more about why patients with hormone receptor-positive breast cancers respond differently to palbociclib and to develop better treatment options for these patients. We will look for genetic changes in each participant's cancer over the course of their treatment in both cancer tissue and blood. We will compare the genetic material from the tumor with the genetic material found in the blood for similarities and differences. This information may help us identify genetic changes, which may help us determine why some patients respond to treatment and other patients do not. This information will hopefully help us develop new, more effective and better tolerated treatments for patients with estrogen receptor-positive, HER2-negative metastatic breast cancer. All patients on the study will receive the results of the tumor and blood genetic sequencing at no cost. This information may be used to help you and your doctor decide on your future treatment options. If you can answer yes to the following statements, this study could be a good option for you. Number 1, female over 18. Number 2, breast cancer that cannot be removed by surgery. Number 3, hormone receptor-positive breast cancer. Number 4, HER2-negative breast cancer. Number 5, about to start treatment with palbociclib and Faslodex or palbociclib and Femara. To participate in PROMISE, you would need to meet with an oncologist at Mayo Clinic in Minnesota, Florida, or Arizona. First, there is a screening period where a tumor biopsy will be collected to confirm that your cancer is estrogen receptor positive and HER2 negative. If it is and you decide to join the study, you will then start your treatment. Blood, urine, saliva, and stool samples are also collected at this time. The biopsy and blood tests are repeated after 2 months and again when your cancer grows on treatment. These tests will help us to understand why the tumors were or became resistant to palbociclib and the anti-hormonal therapies. The stool sample is collected to help us understand whether changes in bacteria in the gut, e.g. the microbiome, influence how well or poorly patients' cancers respond to palbociclib and anti-hormonal treatment. All patients receive treatment with anti-hormonal therapies and palbociclib, which are approved by the Food and Drug Administration for breast cancer, so the study is low risk. You can have your cancer treatment at Mayo Clinic or with a doctor closer to home. You will need to come back to Mayo for tests every 2 to 3 months until palbociclib is found to no longer be working. The results of the genetic testing of both the tumor and the patient may be used to help you and your oncologist to select the next cancer treatment after your cancer grows on anti-hormonal treatment and palbociclib. This genetic testing will be provided to you at no cost. If you are interested in participating in the study, please talk to your doctor. You and your doctor can find out more information here. You may also contact our study team at the following sites. Thank you for considering participation in this research study. The PROMISE study is funded by the Mayo Clinic Center for Individualized Medicine, the American Society of Clinical Oncology, and Conquer Cancer Foundation.